Ever wonder what motivates people to get plastic surgery? Did they regret it? What can we learn from the stories of plastic surgery patients? I'm Dr. Javad Sajan, and this is the Plastic Surgeon Podcast. Hello, my friends. Welcome back, and thanks to our listeners for the amazing feedback. We have had so much fun so far and look forward to more of your insights and suggestions. Please rate and review us on Apple Podcasts to help us get you more amazing content on the Plastic Surgeon Podcast. We listen to real plastic surgery stories of triumph and pain from real patients and providers to further understand their motivations of why they would risk their life under the knife. I'm Dr. Javad Sajan, and today my guest is Colleen. Colleen, it's been a privilege to be your doctor, to get to know you, and to share your life with me as you have so much. Thank you so much. And we're so excited today to get into your life.
Thanks for having me.
Of course. So, Colleen, the surgery I had the privilege of doing for you was a complete body lift, or also known as a 360 belt lipectomy, along with liposuction. Is that right?
Yes. Mm-hmm.
Now, people usually get that surgery after they've lost a lot of weight.
Mm-hmm. Yeah.
How much weight did you lose?
I've lost 140 pounds.
Wow.
At this point. Yeah.
How did you lose the weight?
Well, sort of a variety of ways. I did have a weight loss surgery about 12, 13 years ago, and had lost a good amount of weight, but then had put a little more back on. And then I think last January, I started doing GLP-1 medication to help get the numbers down again to where, yeah.
And I know there's different kinds of weight loss surgeries. There's gastric sleeve, there's gastric bypass. People put balloons, they put belts, not as popular anymore.
Right.
Which one did you have?
I had a gastric sleeve.
And how did you pick that surgery out of all the ones that are available?
Well, unfortunately, my insurance wouldn't pay for surgery, and I went to Mexico and had that, and I had a very good positive experience, but it was one that I felt was accessible for me to be able to do and pay for, and I knew some other people who had some success with that, so that's what I chose.
Where in Mexico did you go?
Tijuana.
Oh, okay. How far is that from Seattle?
That's a good question. Couple thousand miles. I wasn't living in Seattle at the time. I was living in New Mexico. You flew into Tijuana, or flew into actually into the whatever's right above the border there, and then they pick you up and bring you right over the border and take care of you real well there. So it was a positive experience.
And do you mind me asking, how much was the surgery over there?
It was like maybe $7,000 total, I think.
And how much is it in the U.S. to get
Oh my goodness. Yeah. I don't even know, 30, 40.
For an out-of-pocket sleeve?
I believe so. I mean, that was a long time ago. Now it could be, who knows. Yeah.
That's true.
Yeah.
And they picked you up, they took you to the place you stayed. How long did you stay in Tijuana?
I was there for a week. Yeah.
How you said the experience was good, right?
It was positive. They took very good care of me. Yeah.
How long did you get there before surgery?
Oh, it was that day.
Oh, really?
You fly in that morning and you go right to the surgery center, and they start with all your pre-things. They do a cardiology thing, you see, and then by the end of the day, you're having surgery, yeah.
Did you have to have labs and stuff done here before?
A little bit, but not too much. Most of it they did right before. I mean, they had it, sort of to a science getting it done.
And your medications, how did you manage? Did they give them to you over there?
Yeah, I stayed. They have a house where there were nurses and things. So after one night, then you go there and you stay there, and you have constant people there taking care of you for the week. So.
Yeah, and I've done surgery overseas. I've done surgery in Dominican Republic. I've been to Africa. I've done surgery in Colombia, and I've seen it all over the place. Some places are like, wow, this is better than U.S. And other places are like, ooh, that's a rough spot. How was the spot you went to?
I thought it was fantastic. I mean, I did do my homework about the facility and the doctor, and it was top notch. And certainly at the time made something accessible that probably wouldn't have been accessible to me here.
How long did the sleeve take? I know it was 10, 12 years ago.
Yeah. I mean, I still have to be careful how much I eat, when I eat, that it changes that. But for the first handful of years, I definitely lost quite a bit.
How much would you say you lost?
I got down to kind of close to where I am now. Maybe 10 pounds more than now. But then, 8 years in or so, I started to gain some back and gained probably 40, 50 pounds back, which is what I've lost in the last year with the medication. Yeah.
Did you stay overnight there, or they sent you home the same day?
At the surgery, you spent the night in the hospital there. They had a surgery center. And then you went back to their facility where I stayed for the full week before I flew back home.
I see.
Yeah.
Did your husband go with you?
No.
Who did you go with?
My sister went with me.
How did she feel about it?
She was terrible. She surprised me when she got there that she had decided to have a facelift while we were there as well. So the week was more really me taking care of her than her taking care of me, I will say.
Oh, no. So you didn't know until you got there?
No, it was a surprise for me and her whole family. Yeah.
She did it intentionally, or she decided?
Intentionally, yeah. She
didn't want people to know?
Yeah.
How did her facelift go?
Pretty well. Her family wasn't real happy when she got home that she had just decided to do that. But she went and saw a plastic surgeon in the U.S. and said that they had done actually a really good job. Everything looked great. But, I mean, one of the things about that is you don't get the aftercare like you would here in the States. I mean, even for me, I had to go to my regular practitioner and have them take out the
drains.
and things. So, yeah.
Was your regular practitioner okay with that?
Yep, they were. I had set up ahead of time for me. I had done all my work and said, okay, this is what I'm having done. And, and so she worked with me, my practitioner there.
Oh, that's good.
Yeah.
What about your sister? Did she have a plan or not really?
Not really. She was kind of winging it.
Did she have drains and stuff like that?
Oh, yeah. Mm-hmm.
Did somebody local took them out?
Yes.
Was that hard for her?
It was hard for her, yeah.
Oh, I see. No complications, it sounds like.
No. Mm-mm.
After you had your sleeve done, the house that you stayed at there, was it reasonably clean and nice?
It was. Mm-hmm. I had no complaints. Everything was very nice.
Was your husband on board with you having surgery?
He
there?
was. Mm-hmm.
Oh, that's good.
Yeah.
Initially, you lost weight. Did it make it harder for you to eat the gastric sleeve?
It did. Yeah, for sure. I mean, I'd had some dietary issues before that. I had my gallbladder out and had some, so I always kind of had to be careful about what I ate anyway, because certain things would set off that. So similar to that, you can't eat fatty foods or late at night, just certain things can make you feel pretty uncomfortable pretty quickly. I say similarly with the GLP-1 medications, so it's the same. You still have to be pretty careful, because if you eat, too much or too late or then you can feel a little bit of indigestion and uncomfortable pretty quickly. So that's always been sort of the same for me. Yeah.
Had you tried diets and other things before the surgery?
I had, yeah.
What did you do?
Well, actually, way back in the day, I actually owned a couple of Curves for Women, did low carb diet, worked out 5 times a week, the whole thing. And for me, I know the traditional thought about weight loss and obesity and things like that. And we used to be told this, certainly I'm of the age where it's numbers in and numbers out. It's pretty simple, but it is not. It is so much more complicated than that. So for me, I would say, and I know, put the comments, do what you need to, but I've always had a pretty healthy lifestyle. I've been married for 35 years. My husband still wears a 33-inch waist. He eats the food that I cook. He eats way more than I do and stuff that I would never eat. And he has never had, our children were healthy, slim. I mean, I've always been active, but there's other things going on. I don't think we even know that much enough about how people's bodies work. For example, I have a brother who probably has some of the same issues metabolically or genetically that I do, and he has not made healthy choices in his life. He's over 600 pounds. Oh. And I feel like had I not always been active, always cooked healthy food and not eaten out much and be careful how much and what, that I probably would be in the same situation because, clearly for me, just, all those things weren't enough. If it was about having enough willpower, I'd have been thin my whole life. It wasn't about that. Or,
If it's not about calories in and out, and I agree with you, we don't understand everything about metabolic activity and weight loss and gain. What do you think it's about?
I think it's probably a lot of things. I think body chemistry and chemicals, I feel like that can absolutely be different for different people, because the periods of time maybe when I have gained a lot of weight, I wasn't eating very much, but there was maybe stress and other things happening in life that changed my body chemistry that, that made me put on weight really quickly, even though I was maybe barely eating, or just other things. I also have lipedema. So I definitely have, it's a disease that we really don't know enough about either. Pockets of painful, bumpy fat that are very resistant to losing. That will be our next, we're halfway through my journey surgery-wise, because we still have to do some of that, right? Yeah. And, so I think it's... I certainly started to gain weight, the lipedema style weight, in when I went through puberty. I went from being a scrawny little kid to having thunder thighs, and disproportionate thighs and other, compared to other parts of my body. Yeah.
Did you grow up a heavy kid, or were you
I was super skinny, scrawny until puberty.
And then what happened?
And then I ballooned up a little bit, and then always had a little extra weight at least. And then when I got married pretty young, 19, I've been married for 35 years, and things were fairly stable, but I was clearly, overweight compared to where I, should be maybe. But then I had children, and I did great when I was pregnant. I mean, my son was almost 10 pounds, and I gained 21 pounds during the pregnancy. So for some reason, my hormones during pregnancy, made it very easy to maintain and not over. And then after my second pregnancy, gained a lot of weight over a few years after my daughter was born, when we had a really stressful time. So I don't know, cortisol, there's stress hormones, things like that. But
What was the stressful time?
Oh, yeah. Well, we had probably from the time my daughter was about 6 weeks old till she was less than 3, we had many, many people in our very close life die. My father and my mother-in-law. We had a nephew that strangled to death at 18 months in our family. Sorry. And just some very traumatic and very close. Also, I was a mother with 2 young children. My husband was working, 78 hours a week. Life was just a little overwhelming at that point. And when my father passed away, he was diagnosed with cancer and died within 30 days. And my mother, who lived right behind us, we basically lived on one piece of property, was completely unprepared for life in that way. And so it was a very overwhelming period of time with 2 small children. And, and I promise you, I wasn't sitting up with Haagen-Dazs. I was not. I was barely managing to hold everything together, and gained probably 60 pounds in 1 year during that time.
Why do you feel you have to defend yourself and say you weren't eating Haagen-Dazs?
Because, and that is the truth, is that when someone is overweight, societally, people make a judgment about them, that they are maybe lazy, or maybe that they, are gorging themselves. And it's not, for me, it wasn't true. I can only speak for my own journey, but that has never been the case. It's sad that I feel like I have to defend myself, but sometimes I feel like, and often I feel like, when you speak to doctors and things, you might say, hey, this is, and you might say, and they may not believe, they think that something else is happening. So, I did have a doctor sort of about maybe 15 years ago, before I had surgery. There was a doctor in Central Washington that I found who was like, I felt like the first time, like he listened to me. And he actually, before like the modern medications that we have now, tried some medication for me, a few things that sort of helped me. And then I was, dropping some weight and finally having some success. And I think it's just like, and I felt so validated that he believed me, that it wasn't like, no, you're whatever. I mean, at my highest weight, I was 320 pounds, so I mean, but I was doing yoga several times a week, walking 4 miles a day, cooking all fresh food for my family. And yet, it's kind of a disconnect between this is what I'm doing and this is the results I'm getting.
Yeah, and you said you owned some Curve franchise.
Yeah, that was well before then. Yeah,
and you were helping people lose weight.
I was helping people lose weight, and I was teaching the diet classes and doing it, and I was doing like 20 carbs a day, and I still, I mean, it would move a little bit, like 20 pounds down, but it could never really move the scale down. But the positive thing about that, and what I feel like I carried through today, is I did begin to look at results in a different way. And so to find like inner validation that, hey, I made these choices that were healthy for me. I spent the time and energy, even though I'm busy and I'm a mom and I have all this going on, to exercise, to prepare healthy food, to nurture myself. And so I would find the validation in that rather than the number on a scale.
Why do people fat shame?
That's a good question. Probably just traditional ideas, media, Hollywood, shall we say, puts an ideal social media that is unrealistic and unattainable for most people.
Yeah. A lot of doctors who do what I do, they put strict limits. I want to operate on somebody with this BMI or this weight. They won't even see them for a consult. And many of them get away with that because if you're good at what you do, there's a lot of patients who will come to you. Yeah. Do you think that's okay? Restricting patients just purely based on a number?
I would never tell a doctor how to run their practice because I feel like they should have the freedom in some sense. So if they don't feel comfortable, then they should probably, I'm not an expert. However, I really appreciate that you look on a case-by-case basis and look at a total picture. And I feel like hopefully we're moving to a place where more doctors feel comfortable doing that rather than looking at, some metric that might exclude some people who really can use that help.
Yeah, I think in this world that we're going into more automation, AI, people just look for parameters. Yeah. They don't look at people, right? And what I believe is everybody's an individual with a unique physiology and metabolic profile, and that person has to be assessed in that fashion. I agree with you. You can't force someone to do something they don't want to.
Right.
At the same time, everybody deserves a chance. Everyone deserves an assessment, and there are people who do that. But I think in Seattle especially, there's a lot of doctors who have strict limits. I think, from what I recall, I'm one of the very few, if not the only one, who has no BMI limit. Where I'll see the patient and sort of assess them individually, but it's not for everybody. It's a difficult thing for many people. People come in crying from their past experiences. I think you had some of that too. Did you ever have a provider not be nice because of the way you presented?
Well, I mean, no. For me, that hasn't been. I really did my research before I even attempted to talk to somebody.
Yeah.
And I'm also, I mean, I like you, but I'm not overly like doctor happy. I don't love.
Yeah.
I mean, that's.
I'm the same way.
Yeah. I don't. I mean, if I don't
I still don't have a primary care. I'm working on it.
Yeah, I'm doing really good. I'm really working on it, but it's a struggle for me a little bit.
Yeah.
To trust the medical profession and
Why do you think that is?
Well, for me, probably how I was raised. My parents were weirdos. So,
where did you grow up?
In Florida.
What part of Florida?
Central Florida.
Okay, Orlando area.
Yeah.
Okay.
Mm-hmm. Yeah. Yep. And my parents were like, I don't know. I'd like to say they were free spirited, but probably a lot of it was financially based, free spirited. So they didn't always bring us to doctors or.
How did you get your vaccines for school?
We would go to the health clinic to get those.
Okay.
But very rarely would see doctors or, yeah.
Did your parents work?
They did.
Intermittently?
Yeah. My father was too smart to work for anybody else, so he couldn't.
How did they make a living?
Lots of varieties of ways. My dad had lots of different jobs. Eventually, he ended up having a painting business of his own, and that because he really couldn't work for other people. He was just too smart and and wanted a quicker, easier way to make money. So,
how many siblings did you have?
I am the youngest of 7.
Wow.
So my parents were both married before, so it's kind of yours, mine, and ours. My brother, who I spoke about earlier, is my only full sibling. So,
I see. And he struggled with weight.
Oh, yes.
How is he doing now?
He is taking a GLP-1.
Okay.
And he's losing some, but I mean, he's at some point when you then also have back problems and diabetes and are fairly immobile, it gets harder and harder to make any real changes. But I'm hopeful that it will make enough difference that he can maybe reverse some of these issues. We'll see.
Did you always have more weight growing up?
No, neither of us were particularly pudgy as kids at all.
What about your parents?
No, pretty average.
Yeah. How long did you live in Florida?
Until about, let's see, I think I was 36 or 37 when we started traveling. Okay, so the story is this. We lived there, we had our kids there, and then when our youngest was about to turn 8, the economy just changed. My husband's an electrician, a union electrician. And so there was no work in Florida for the first time ever. He was laid off.
When was this? 2008-ish?
No, it hit Florida first because we had in 2006, 3 hurricanes come through. So all the big building and stuff kind of stopped. And then the rest of the country kind of followed a little bit after that. But for sure, Central Florida, the economy really slowed down well before that. And so my husband said, well, I could travel. There's work in other parts of the country. So he headed off to travel. And then after the kids finished that year of school, I'm like, well, then we're coming.
Yeah.
And so we actually, for 5 years, lived in our RV and traveled around, and I homeschooled the kids, and it was great. We had a great adventure and saw a lot of the country.
How was he finding jobs, sort of?
Well, I mean, union, the way the union works is if there's surplus in area where they need more labor, you can come in and sign the book as a traveler, and then when all the local people have filled the work, then they pull from that traveling book, and so and then they have the opportunity to work. So
What states did you all go to?
Well, it's central. We were in Central Washington, which is when we decided that we loved up here and would look for an opportunity at some point to move here permanently. But we worked in Central Washington, doing all those stuff that you do over there.
Yeah.
He worked at the nuclear facility in Hanford and stuff. And then Utah, which is a beautiful state. He worked in Utah. He worked in New Mexico. He worked in Texas. He worked in upstate New York. So a good bit across the country. Yeah.
How many kids did you all have?
We have 2 children.
Oh, okay.
Yeah.
Boy, girl?
A boy and a girl, and they're both in the Seattle area. Our son's a nuclear operator in the Navy and working on I think electrical engineering degree. So smart guy. And our daughter is in Capitol Hill. She's married and doing great. Got her master's.
That's so cool.
Happy and healthy.
Yeah. Other than Washington and Utah, did you all live anywhere else?
New York, upstate New York. New Mexico. Yeah, those are the most of the states that we like lived in. Yeah.
And I know you went through a difficult time that you shared with us about.
Yeah.
Where you had the weight gain and loss.
Mm-hmm.
What made you finally decide that you were going to consider a weight loss surgery?
Okay, so when we traveled, like we always would have big adventures, and we want to, we wanted to be active and go hiking, and I just didn't want like my weight or physical issues to keep me from doing things that I wanted to do, like going out for a whole day hike, going out for or whatever. So I just wanted to be able to do the things that I wanted to do, with my family and be active. And I knew that at some point, and I'm stubborn. So I felt like I should be able to fix this. I should be able to figure this out. But at some point I realized, all right, I need to accept the fact that this is an area that I need help. I can't, if I could have done this myself, I'd have done it by now. And to be okay to accept help, medical help, whatever kind of help. Yeah.
Were people around you not supportive of getting a gastric sleeve?
Oh, no, they were. My husband's very supportive. He's wonderful. He loved me at 320 pounds. He's loved me at, it's never been an issue, and has been supportive of whatever I would like to do.
Did your brother think about having surgery, or did you ever talk to him about it?
I think he had hoped to at some point, but because he's unable to work and he's on Medicaid, he has not qualified to be able to do that ever. Yeah.
After you lost the weight, you said we talked about this a little bit, but you started a GLP, right? So GLP drugs are the semaglutide, tirzepatide, that family, liraglutide. Which one did you go on?
I'm doing Ozempic.
Okay. Ozempic is, the generic name is semaglutide.
Yeah.
How did you pick that one, or was it just prescribed to you?
I talked with my provider, and we felt like that would be the one. She felt like that would be the one to try. Yeah. Okay. So I'm like, yeah, let's give it a try and see.
And the other one is tirzepatide. Tirzepatide is newer, works on more receptors. Some people think it might...
Zepbound, right?
Yeah, Zepbound is a brand name. You're correct. People think it might be more effective.
Right.
How did you decide not to do that one?
I left that up to my provider, and I was willing to try. We've worked together as far as dosing and whether I was getting, results, and how I felt, what kind of side effects I might be, having. So, and then we were certainly able to try a different one. Also, my insurance did pay for that, so, which is fantastic. I know not everyone's is. So I'm like, okay, this one was approved, and let's give it a try and see. And I've had good results. Yeah.
And Ozempic starts at a low dose, and you ramp it up, right? You start at like 0.2 milligrams. Yeah. People take it all the way to 2.4. What dose are you at? Right?
I'm only at 1. I mean, I stopped taking it when I had surgery for the, a few months, a month before and then after. And then I started back in like January because I really need to lose another 20 pounds or so before my next surgery, or so my surgeon says. That's the goal. Yeah. And I'm on board with that. And so I'm trying to keep a lower dose, kind of balance out as I'm adding more exercise and activity in now. And then so I can have hopefully keep at a low dose and still keep a nice moderate loss of weight. That's the plan.
And have you been working and going through all this weight loss journey, or have you been at home?
I started a new job in end of January. Yeah. So, and it's an active job. I work with children. So I spent my day with 8 2-year-olds all day.
What do you do?
I work in childcare.
Oh, cool.
So, yeah, it's very rewarding, but it's also physically demanding.
Oh, mentally, it must be a lot, very demanding.
Yeah.
When I go home to my kids, I love them and I enjoy playing with them, but they take all the energy out.
Yeah, they do. Well, imagine 8 2-year-olds in one room, all day. Potty training and all that fun stuff. Yeah. But I enjoy the challenge. It's fun.
You had an incredible journey with the gastric sleeve, and then you did Ozempic. You got close to your goal weight, and then you had a lot of skin.
Well, I do. Had a ton of skin all around. And then also my legs have a lot of skin plus a lot of pockets of the bumpy fat. So that still has to be done. But yeah, I had a lot of skin. Yeah.
How would that skin bother you?
Well, that's, trust me, if you were carrying that around, it would bother you too. I mean, it makes it hard to move. And I've been reflecting while thinking about doing this about like, why did I have surgery? What's the, and so for me, I think I certainly wasn't trying to please anybody else or look better for anybody else. My husband loves me anyway, and that's fine. This was about me and also about like, I feel like my journey, and it's not just the physical, but the other changes, all these changes have happened. And I want my body to reflect that, and it's in this kind of fullness. So kind of bring a sort of connection to the outside and the inside. So for me, that extra skin, I feel like underneath, I've been working, and I have maybe toned muscles and things that are underneath, but you can't see it because there's all of this there that is not just going to go away.
No.
There was no way for that to happen. So it's just nice to feel like, okay, after years of trying to make positive choices and doing the right thing and not always seeing the results, but still plowing ahead and, keeping to trying to, then finally it's like, okay, the results of all of that are now able to be me see and feel.
It's important.
Do you know what I mean?
Yes. Like you were wearing a big down jacket over this amazing structure that you had built.
Yeah. A weird side note to that, when you said wearing a jacket, another part of my journey probably, and I mean, I don't know how this works, whether it was part of why I gained weight and was heavy or not, but I am a survivor of childhood sexual trauma. And so I do feel like people who have those, have had those things happen, that especially in my early adulthood, I probably felt more comfortable with weight on. Like you say, it's like wearing a jacket, something to protect you, something to a barrier between you and other people, a way for you to deflect attention that could be of a sexual nature. So for me, it's like I've come through, these journeys and think about these things and work on it. And it's like, I don't need that jacket anymore. I don't need to have this. I'm ready to shed that. And so that was also part of my journey.
And if you're not comfortable sharing,
I'm comfortable.
How old were you when the trauma happened?
Pretty young. Yeah. And then
Younger
through
than
some
5?
years. Yeah.
Around 5?
Yeah. Mm-hmm.
What happened?
Well, I don't know if I want to totally get into that, but we were certainly exposed to a lot of inappropriate sexual environments in my childhood.
Was it for many years or just a finite?
A few pockets of time that not like long term for years and years. No.
Oh, I see.
But some, yeah.
Okay. How did it end?
It ended. Some of it ended earlier on because my parents changed their lifestyle a little bit.
Sure.
So we weren't around people who
I understand.
Or whatever. And then some of it ended later with just basically the person who was abusing me saying, like, basically, if you touch me again, I'm going to stab you or whatever. I mean, just having to advocate for myself because there was not the protection from where it should have been coming from.
I understand.
At some point.
And we don't have to go into this.
I mean, yeah.
Was it a family member?
It was a family member, yeah.
Okay.
Those are complicated.
I understand. And when you were old enough to understand more what was going on, that's when
Correct.
you stopped it.
Yeah. Mm-hmm.
Was that around puberty?
Yeah, that was puberty time. Yeah.
Mm-hmm. That's around the same time you had the weight fluctuation.
Yeah, I mean, for sure. Yeah.
Has that ever come back to haunt you, or is something you tucked away? There
certainly are times when it has you really want to get into this, huh? Okay. That it has haunted me. In college, I had some negative sexual experiences where I was date raped, shall we say, or whatever. And I would say that even though I felt like the stuff from earlier in childhood I had kind of pushed away and shelved, it came back with a vengeance, after that for a very short period of time until I said, oh no, that's not where we're going with life. I mean, I think people who have had, I think part of it is like you're saying, oh no, this was just an experience that happened to me and I didn't have control, but it's not going to control my life. I'm going to. But as a young person who doesn't know how to, sometimes then it leads to negative behavior that you do on yourself because, you're just trying to cope and deal with that. But
how were you able to take control and navigate it towards a direction where you could not be in such a bad spot in college?
So for me, I feel like I've always tried to look at like my choices and what the activity that you're doing and the choice that you're doing, what does it lead to? All right. So my analogy I've always kind of thought about is like, sometimes people like, I don't think people like go out and say, oh, I'm going to go out and I'm going to become addicted to blah, 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 and blah. I'm going to, end up on the street. And nobody wants that for themselves. However, sometimes people participate in risky behavior because they think, oh, it'll be fun. But I always have had, I think, the ability to say, oh, no, this leads to this path down here, which is not where I want. I had very goals for myself, what I wanted in life, where I saw my life to be. And so for the most part, I've tried to like make my choices, the choices that are going to lead to that, and not just choices because I really want to or whatever. Does that make sense?
Yes. How did you have the insight to understand you were going in not the right direction or the situation wasn't the right direction?
I mean, if you're involved in risky behavior and you say, oh, no, that's not what I want in my life.
Some people hit a rock bottom before they get there.
And it was a very, very short period of time, very close after I was raped, that I like literally had some very casual, basically to prove like that didn't mean anything. In fact, and then very shortly after that said, wait a minute, that's not who I am. That's not what I want in my life. And I can choose to do differently. If I really don't want this to control me, that's exactly what it's doing by, in that way. So, yeah.
You're such an insightful person who knows their final direction. Not many people put that together.
Thank you.
Yeah.
Being the youngest, I could see a lot of the mistakes that my older siblings made. And so I could hopefully learn from some of their mistakes instead of repeating the mistakes. I say that my brother, who's had a lot of struggles in life, when I was in high school, he had already dropped out of school. And I would regularly like go to school and he'd be laying in the front yard in his own vomit where he had passed out from whatever, and so I was like, nope, not going to do that. Nope. I mean, I could see very, openly like, okay, I'm going to be a good student. I'm going to do, I'm going to not mess around with this, that, and the other. I'm going to, yeah. So
where did you meet your husband in your journey?
I was in college, like my first year in college, a little, pretty close to after all that happened. Then we met probably 3 or 4 months later. And I was really not looking to be in a serious relationship or in any relationship. I'm a musician by trade and in college. So I was spending all my time practicing and playing and doing all this. But I had in my mind a very specific list of what like my partner and spouse would be, who he would be. Do you know what I mean? Like I knew like, okay, check. Like I'm not going to accept less than these things. And then I met him and it was like, oh, okay, well the timing's not perfect, but like this makes sense to us. And so, yeah.
Was he a fellow student?
No, he was not. No, he was already working in his field as an electrician. So,
How did you run into him?
We ran into each other at church, actually.
Okay.
But yeah.
What kind of church did you go to?
It was a kind of a Pentecostal. So we don't really go now here, but yeah, that's sort of how I grew up later in my childhood and then early adulthood.
When I remember you said your husband checked off your list. Did you know he was the one, or did it take some time?
We knew real quickly, very quickly. And he knew. I would say, well, we got engaged 4 months after we met.
Wow.
And he was like, "That's the person I'm gonna marry." And I was like, "Oh, really? Okay." And so it went really quickly.
Yeah.
Yeah. And people sometimes say, "What's the secret to a happy marriage or whatever?" And I'm like, choose the right person. He was,
Yeah.
and I was right. He's been a fantastic husband, father.
Yeah, every time I see you all together, I can see you have amazing chemistry, and he's been there for you the whole journey that I've been a part of it, that I can see.
He's strong and steady,
Yeah.
which is good because I'm sometimes, but he is, and that works for us really well.
Yes. When you were looking for a doctor to help you with your surgery to remove the skin, the coat, how did you do that?
I went online and looked at reviews, and also, like you said, I was I called a few places because I knew I needed to deal with the lipedema too, and finding a doctor who does that even is pretty tricky. And so when I talked to people from your office and they were like, "Oh, would you like to come in for a consultation?" I'm like, I would. Yeah. Yeah. Let's do this. I had been working where it would have been probably impractical for me to take the time off for surgery. And then I had a break from work because I was working as a nanny, and my family moved out of the state. And I said to myself, I'm going to take the next 6 months off, and I'm going to take some time for me, and I'm going to find, a doctor, and I'm going to get this done. And then I found you.
Did you have other consults or just me?
I did just one video conference with another doctor.
What state was that doctor in?
Also in this state.
And what made you want to decide to come to me?
Well, for one thing, they had it was going to be 18-month wait list to even get an in-person thing with them. And then it just didn't add up. It didn't feel personal. I didn't feel like there was, a great connection.
And then you had the consult with me, you did your research,
and
you felt better about it.
I felt very comfortable from the moment I walked into your office. For me, who's not a super into the aesthetics of, I really don't wear makeup. I'm I'm not so I wasn't sure, it's a plastic surgeon. What's it going to be like? But it was great. And I also loved some of the other work that you do. And I feel like that says a lot about who you are. And I'm like, okay, I'm down with that. This is, somebody whose their work is meaningful, and it's not just finding the quickest or whatever. I don't know if other surgeons are like that or not. I don't want to make a judgment.
Sure,
but I felt like, wow, that makes a lot of sense to me, and somebody who might understand somebody with a journey, and who,
Then you signed up for surgery.
Yep.
Was it hard to make that final decision?
No. It's a lot of money to spend for everyday people. I was an electrician. I work with kids.
I know.
But I'm like, you know what? I need to do this. I need to do it now. I'm 55. Now is the time, to enter into the next phase of my life as my true self. Like you say, taking off that coat and being free of some of that stuff.
How was it the day of surgery when you went home?
My husband took very good care of me.
And you had an extensive surgery.
Yeah.
And for people who don't know, a belt lipectomy or total body lift is where we liposuction the whole midsection, upper, mid, lower abdomen, the back, the sides. You cut 360. So you're basically, for lack of a better way of saying it, cutting someone in half, pulling the back down, pulling the stomach down, pulling the pubic area up, the love handles up, the entire waist, everything down, tightening the muscles and putting it all back together.
Mm-hmm.
So it's a pretty extensive operation.
Yeah.
And that night when you went home, were you in a lot of pain?
That day was not so bad. I feel like, there's stuff that you put in with the surgery. Mm-hmm. And I have a very high tolerance for pain. I will say that. And so I sort of had the idea that I am not going to I'll fill the prescription, but I am not going to take these opioids because I'm not playing with that. I'll manage. And that is, no. The first 5 days are no joke, very painful.
Was the stomach hurting the most, the back, or just everything?
It's pretty much everywhere. Plus, I mean, the reality is for all those muscles and everything in there, you can't sit, turn, move, cough, pee, anything without all of those feeling. So for the first 5 days, like, those were very necessary. After that, it was manageable. However, had I known it was going to be that painful, I still would have done it, been fine. Because I've, had the flu where I thought I was going to die for 2 days and didn't have any, thing to show for it afterwards. So well worth, but you need to go in like prepared that, those first 5 days are pretty rough.
Were you happy with your results for the surgery I did?
Oh, yeah. Yeah. I think, very, I'm over, I think you under promised and over delivered. I think that's what I'm trying to say. Yeah. Because I wasn't sure, once all that's off, I mean, I felt like, okay, there's muscles in there and there's, but, to see it is pretty amazing.
What was most impressive about what you saw?
That's a good question. I mean, just to see my actual shape without all of that skin, is I'm like, oh, look, I got this nice little waist. Yeah.
Did your husband I know he accepts you anyway.
He does.
Did he have anything to say about it?
Sure, a few things.
Okay, that's
He's
good.
happy.
Yeah, that's nice. That's nice to hear.
Yeah.
If you could go back and share anything you wish you would have known before you did the surgery with me, is there anything you would share with somebody who's thinking about getting a body lift done? Okay,
I would say give yourself enough time to really recover. Don't feel like, and I was not working, so I had plenty of time, but I really needed that time. Like, I took, 2 months before I considered like starting to look for a job and getting back. So, I mean, I know some people think like they want to try to get back to work, but I really think that you need that time, more time than you think to really let your body adjust and heal. And that could be very beneficial. So,
absolutely.
Yeah.
I understand. Well, thank you, Colleen. Thanks for listening to the Plastic Surgeon Podcast, and please rate us, review us on Apple Podcasts for more great content. For my live surgeries and adventures throughout the week, catch us on all social media and Instagram at Real Dr. Seattle. Bam, what?